Hey everybody, welcome back to Bruckner Oncology. So today we're in Dr. Bruckner's office here in Bronx, and we're here to do a site initiation visit for a study. Dr. Bruckner has done how many studies do you think in your career?
50 plus.
Over 50 studies. Most of them investigator initiated or academia?
Most of them are academic, National Cancer Institute.
Mm-hmm. And a few
Done
have
a
been
few industry studies
industry
as
studies.
well, and at least half of them industry
Mm-hmm.
was very interested.
And the one we're here for, is this academia or is this industry?
This one's industry.
This one is one of the industry ones. Okay. So it's going to be a
And
little bit different.
This
than-
one's Bristol Myers.
Okay. It's going to be a little different, and that's why the staff, they have their own process for doing the academic type of studies.
Yeah.
This is slightly different.
But it won't be that different because I'm going to do what I've done forever. Whether they're on a study or not, I want the records to meet academic research standards.
Right.
That's been my rule from day one, because you never know when something comes up that's worth reporting in retrospect.
Mm-hmm.
And if you didn't keep good records, you have no way of knowing and sharing what you've done.
So let's talk about that. So earlier you mentioned on one of these trials you got audited, right? Because the results were so good on your end.
Well, every trial is audited.
Mm-hmm.
Anything that goes to the IRB is audited.
Correct.
And I've had IRB independent doctors make rounds with me. In some institutions, practically on a daily basis,
Mm-hmm.
because people, first the IRB wants them to see what we're doing.
Mm-hmm.
And then the guys who come are so interested in what they see, they won't go away.
They won't go away. And so talk about that. What was your process here that you implemented at Bruckner Oncology to create a successful quality capture and quality collection experience for you that you then can go submit to the FDA? And you've done it a number of times with successful
Yes.
results, right?
Every couple of years, we have a trial that the FDA uses, and I've monitored umpteen other institutional
Mm-hmm.
trials.
Mm-hmm.
Some are academic, and some are drug company,
Mm-hmm.
but they're all academic standard.
Mm-hmm.
Because of those are the people I've always worked with, academicians.
So if any physicians are watching this, what is some advice, especially oncologists, what is some advice you give them as far as them wanting to get started with research? Because you've done it successfully. So what is some advice you have for a physician maybe who's just getting started in research?
Always assume that people are going to come and look at your records.
Always.
Always, from day one.
Mm-hmm.
You always want to have records that you can be proud of.
Mm-hmm.
You want to keep your records in real time.
Mm-hmm.
If you are going to put yourself in a public forum, you have to meet the criteria that you would expect others to satisfy if you were doing the inspection. Records have to be kept real-time, prospective. There has to be a paper trail, and these days there has to be at least a duplicate electronic real-time trail. It used to be that the electronics were the duplicate. Now it's the paper that's the duplicate.
That's right. That's right.
That's changed, but basically everything has to be easily available. You can't say, if I need it, I'll get it later. If it passes through your hands once, you want it to go into a accessible file. Yeah.
So that's some advice for the physicians. Now I want to give a little advice to the...
And what everyone wants, a pathology report, an operative report. Ideally, you have an independent physician who has seen the patient, and you have their best note confirming that they have seen and have given the same assessment of the patient that you gave.
Thank you for that.
You need your colleagues' input. You need your pathologist. You need your surgeon, his note, not just a phone call.
Not a phone call, yes, you need the actual note.
And you want to look at those reports and ask, are they complete enough? If they're not, you have to call and ask for an addendum. I call pathologists all the time and say, I need more. We want it there, not chasing it after the fact.
You can never have too much when doing research.
And I always used to tell my fellows, the pathology report is so important. And I used to actually tell them, go visit the pathologist, look at the specimen, see if this pathologist is describing things in a way that do justice to the actual specimen. And unfortunately, or fortunately, over the years, we found that some pathologists better than others.
Right.
And for instance, if I'm doing an adjuvant trial, we're talking curative surgery, I always talk to the pathologist. We've seen reports that don't do justice or actually are staging errors. And it's not me. If any good cancer center protocol, when an outside patient comes in, they review the pathology internally. Over the years, I've been involved in several quality studies, and you have to expect a 5 to 10% error rate in in the information that is incoming.
Mm-hmm.
So you have to have that vigilance. If you've never found something to question, you didn't look hard enough.
There's always something. And what's
But it's a low level, but for that patient, it's 100%.
yeah.
You don't want avoidable mistakes.
Now let's talk about the
It's
patient.
cancer center criteria.
Yeah.
Extra double check.
So we have a lot of patients watching. Matter of fact, for the study that we're here for today, we had a patient go on clinicaltrials.gov, search a specific kind of cancer, and this study popped up. So what is some advice you have for patients out there when they're selecting a trial and selecting a physician, a principal investigator, to join the trial lab? In your opinion, because you've done so many studies, what should the patients be looking for?
Okay, different doctors have very different opinions
Mm-hmm.
of what people should be looking for. And there's more than a little philosophy and
Yeah.
personal values involved.
Right.
I'm actually, I think, quite conservative in terms of, people think I am very research friendly, but at the same time, I like trials that are immediately valuable for patients. I like good phase 2s
Phase 2.
that
Okay.
look at really promising drugs. I like the hot stuff.
Yeah.
I am not, I respect basic research. I respect phase 1.
Mm-hmm.
I know it has to be done,
Mm-hmm.
but my preference is agents that a number of oncologists
Mm-hmm.
agree are promising, they've seen actual benefit, and I like to try to take something that has some value,
Mm-hmm.
make it safer,
Mm-hmm.
and expand the area in which it can be used.
Yeah.
I think that is where the money is for a patient who's looking to do something for themselves.
Best value for them.
And I sort of like what's best value.